G'day, it's Paul. This case is a left breast FNA from a 52-year-old female, and the clinical notes were query fibrocystic change or fibroadenoma. Check it out. So what do you think? There wasn't a whole lot of cellular material on the slides, and they probably weren't the best preparations. A little difficult to see, especially DivQuicks. The outstanding feature was a large amount of mucin-like material in the background. And then in terms of epithelial cellularity, it was quite low, but there were small-ish cohesive epithelial cell groups. They appeared kind of flat and organized and appeared to be bimodal. Couldn't see any bare bipolar nuclei in the background, but there was so much background material that probably wasn't surprising. So although this looked benign in terms of the epithelial cells, we reported this as atypical, category 3, and recommended excisional biopsy. It said it was a possible mucinous lesion. And this was confirmed on histology. This was reported as a mucocele-like lesion of breast with no evidence of invasive cancer. These lesions are named after the salivary gland benign lesions, and they're characterized by multiple aggregated mucin-filled cysts. These are lined by flat or low cuboidal epithelium, and they may be associated with atypical ductal hyperplasia, ductal carcinoma in situ, or invasive carcinoma, so mucinous carcinoma. Now, in addition to mucinous carcinoma, there's a number of benign lesions that can produce a rich mucin-like background to breast FNA specimens. This can include fibrocystic change, where you get abundant luminal mucin, like this example here, a fibroadenoma with myxoid degeneration, where you can get quite an abundant mucin-like material in the background, sometimes as well fragments of myxovascular tissue. Generally, they're cellular with nice rounded groups and have abundant bare bipolar nuclei in the background. Phyllodes tumor can also produce a myxoid mucin-like background to the slides. And mucinous carcinoma, of course, can occur with abundant mucin. Often it's characterized as well by some loss of cohesion with often kind of plasmacytoid looking cells and nuclear atypia, as well as branching vessels. If those are present, then it should be considered suspicious. In our experience, about 20% of cases with abundant mucin are benign on excision. However, due to the sampling difficulties, excisional biopsy is usually advised to exclude mucocele-like lesion with ADH or DCIS. So I hope you enjoyed that case. Thanks for watching.